I'm adjunct faculty there. I got colleagues there. I got medical people around me. I surround myself with people that I think are sharp, psychiatrists, physicians, oncologists, just in case. And still, my patients are going to go to other doctors because they're just looking for the answer. To me, that's sort of within that health anxiety spectrum. If every doctor you've gone to that I trust has given you the best medicine possible or the best assessment possible, and you're getting no answer, and you go to the next person, you don't need the DSM to go, maybe this is more than just a medical issue. I'm still going to advocate for the medical needs. I'm still going to support them and join them. And I'm still going to help them see that your physical symptoms are real. Physical symptoms are real. That doesn't mean they're indicative of or prognosticate a medical condition. Half the battle I'm doing is education around that topic.
Yeah, I think it's worth stating that again, right? So if a person says, I'm experiencing this pain, that's real.
100%.
You're just saying, don't assume necessarily that that means that there is an underlying medical reason for that, or even something that you would find on the total best case scenario diagnostic.
More often than not, there's not a great medical diagnosis or category that fits into the things that someone like I see. I mean, I don't specialize that much in FND or sort of that functional neurological space of pseudo seizures or tingling arms or body parts that can go numb. That's a whole nother space of conversion disorders. But I'm talking about people that have chronic headaches, tummy issues, leg cramps, bones that feel sore. And they've had every workup you could imagine that would be considerate for someone who has bones that are sore. And there's about 3 or 4 conditions most of us are going to jump to when you say your bones are sore. And when that's all been ruled out, and they try and convince you, but my thigh, like I can feel the bone, I can feel the marrow. It feels like it's tearing itself up. And we were talking about pain conditions. We're talking about, neuropathic kind of conditions. At some point, the intervention, which is them doctor shopping, becomes worse than the pain itself. At some point, someone will prescribe you something, and hopefully we're not dealing with opiates at that point, but someone will prescribe you something, thinking that they have the magical cure to fix your distress, your pain. And that scares me. And my job is to sit with them and say, the pain is real, the sensation is real, the symptom is real, but it may not really be indicative of the thing that you think it could be. And by the way, going on WebMD or Google, or because a social media influencer said, if you have this, this is probably what it is, does not diagnose you.